Welcome back to Albany County Direct. I'm your host, Albany County Executive Daniel McCoy. Here with me today are two extraordinary people, Kevin Coffey, Regional Chief Executive Officer for the American Red Cross, and Dr. Navarette, our Commissioner for the Albany County Department of Health. Thank you both for being here today. Appreciate it.
Happy to be here.
Not that you had a choice to join me, Doctor, but you had to come there, right?
Always happy to do it.
Right? So, no, again, thank you to everybody. And we've seen some significant flooding over the area recently, and we used to get the 100-year storms, and now they're here every year. We're seeing more and more flooding, and the Red Cross has been there helping residents since the beginning of time, and it's a really important part of our community that helps people in their worst times. And I can't thank your organization enough for what you do all the time. But can you briefly talk about the Red Cross's response and then tell us what you're seeing more and more right now besides the floods and everything else?
Sure. Thank you so much, County Executive McCoy. So yes, the Red Cross is responding to disasters every 8 minutes. And what we saw in Albany on July 29th was the second rainiest day event recorded. The one before that was, Tropical Storm Floyd.
I know, we're like breaking records, right?
Yeah, not the records you want to break.
No, I 100% agree.
But when we see these significant events, folks are being displaced, they're losing their homes. It's very disruptive to communities. So immediately what happens, the Red Cross will mobilize with community partners. So during that event, we had 2 shelters open. Those were places that folks could, seek immediate shelter, and we had food and other resources there. And then we helped families on the road to recovery. So we went out in the community, did community damage assessment, and then we opened a multi-agency resource center. So we had volunteers staff in that resource center to provide additional services. We had the Salvation Army there. We had Department of Homeland Security Emergency Services doing additional services. And we brought in community partners to help folks on the road to recovery. We also handed out cleanup kits because folks are cleaning out their basements and their homes that had been flooded. So and
I always love when something like this happens and you see all the local hardware stores. All of a sudden they have a shortage. All of a sudden the prices go up, which is a whole other headache for people at that point in time. Yeah,
we always say be prepared for disasters. We know these events are going to happen. And what is your family plan to be, prepared? Do you have some food? Do you have some water? Do you have medications? What are your supplies for your pets? What are you going to do if we have a prolonged power outage? The best time to plan for a disaster before it happens.
Which is nuts. But at the same time, the Red Cross is dealing with something we don't see very often. Only the second blood crisis in your organization history, I believe, right, is going on right now. And how serious is the shortage right now going on?
This is a significant shortage. Like you said, it's the second time we've ever declared a national blood crisis. The last time was during the COVID-19 pandemic. So we are really seeing kind of a perfect storm of, events where summer is when we typically see a shortage of blood donations, but then we've had significant weather events. That coupled with hospital demand increasing, more trauma cases and patients needing care. We've seen just a decline, a 4-year low of our supply. So every day we need to collect 13,000 units across the country to maintain the blood supply, and we've seen it reach critical levels. So that's why we're engaging the community to really roll up their sleeves and help their neighbors in this time.
It is. It's so important for people to donate blood, and especially if they have a rare type blood, and it takes 10 minutes. Right.
It's a very simple process.
Right.
Within an hour, you can get a health history, so you can find out your own health history. You donate blood, you're saving someone's life, and you get juice and cookies. So it's a great reward.
That is a great reward, right? Maybe we'll get more police officers then, right? If you tell them they're going to get some free food, right? But in all seriousness, one of the things I always hear back, who hate getting needles, right? Or you have to get blood drawn. What's it there? And I don't want to pick on the places that are out there that draw blood when your doctor goes, hey, go get this, go get a blood sample, and they prick you like 8 times, right? What is the difference? Because you're more seamless. I'm not saying the other people aren't professional, so I want to clarify that. But it's an easier process, and you're going to get a little pinch, and it's over with.
It's a very simple process, and our phlebotomists are wonderfully trained and take exceptional care of anyone who comes to our blood. Either our blood donation center on Everett Road or any of the mobile drives that we have throughout the community. Our team take exceptional care of the folks that are coming.
Thank you for sharing that. But Dr. Navarette, from a public health point of view, what does a blood shortage mean for the hospitals, healthcare providers, and patients here in Albany County?
Yeah, it really does compromise the care that they can give. Kevin mentioned it perfectly. Summer is a time we think about traumas, anybody who comes in and who needs a blood transfusion after losing a lot of blood, but it doesn't stop there. So things like childbirth and somebody who loses a lot of blood. We have lots of mothers who we care about, and we want to make sure that they get the proper care that they need. Also things like surgery, right, and cancer. We all have loved ones who we know are going through these kind of health challenges. And when hospitals don't have the adequate supply, it really does compromise the care. I think one of their biggest challenges is that supply is that it doesn't last a long time. Red blood cells only last about 5 weeks. And so it's very challenging to meet that supply demand on a constant basis. It really is a maintenance issue. And so when people stop donating, either because they're on vacation or we have weather events during the summer, but then that demand goes up, we really come into the crisis that we're having right now.
So I know you kind of answered this a little bit, but what do you two, either or, think, what is contributing to the shortage right now?
Definitely the summer is when we see a decline. Folks are taking their summer vacations, and a lot of schools that have their regular scheduled drives are not in session. So we lose a little bit of that, blood supply, if you will. But also weather events. We had earlier in the summer, the wildfires in Canada produced some significant, smoke in the area. Then we had flooding events. All of those contributed. Like if one drive gets canceled, think of that cascaded event across the country. So in every 2 seconds, someone needs blood. So Dr. Navarette was talking about a trauma patient. I have a board member in Syracuse. His child had brain cancer. He went to the hospital and they didn't have platelets for his son. And they had to tell his son that you have to go home and come back tomorrow. No parent should ever be in a situation where you can't get care because there's no blood products available. If that was my child, I'd become a loyal blood donor right there. But until you're faced with that situation of needing a blood product, it could be any one of us sitting at this table that needs it. And I think that's the community needs to come together and make sure that no patient ever experiences that trauma.
And that story means so much because you're right. Most people go on with their daily lives and they don't think about it until, God forbid, someone they know goes through that and they're like, and then they get all into it. And like again, 20 minutes out of your day, once a month or every 6 months, really makes a difference, right? For the blood shortage. So I know you're getting ready for 9/11 Memorial to remember 9/11, and you're doing a blood drive. Why is it so important? Because when you're doing this blood drive also, and I'll say this, being a former firefighter, it means a lot to remember the people that lost their lives on 9/11, the first responders, everyone that responded. Why is this thing so important to the American Red Cross?
So 9/11 represented one of the largest mobilizations for the Red Cross in our history. We had about 56,000 volunteers around the country that, supported events at Ground Zero, Pentagon, and Shanksville. And what we saw as a country is the community came together. So when we say never forget, we really want to make sure that we honor the legacy of, the folks that lost their lives in that horrendous event. And also we come together to help, give back in a day of service. We had many volunteers from Albany County that were first responders down in the World Trade Center. One local volunteer, I remember, he was the first to do damage assessment in the city. So, our hope is we can, do a large Day of Remembrance blood drive to really, celebrate the community coming together to support one another, just like we did, during 9/11.
And people don't realize, like, from the wildfires and everything else going all across this country, from California back over to the East Coast, and the floodings. And I was just down in New Orleans for a conference with NACO because I'm on the board of directors there, and they're still recovering from that. And it's amazing all these years later. And then some of the gripe I get is, like, last night I'm watching the news. I'm waiting for someone today to say something because they were talking about, and I believe it was in Amsterdam, where the flooding happened there, and the Canal Corps rebuilt a historic home and they raised it up, and people are like, we're still rebuilding, we need help. Our own houses aren't rebuilt. And like you just said, every 8 minutes is really alarming. I didn't know it was that much that you respond. And as you get prepared and you need volunteers, and I'll get to Dr. Navarette because we have the the American
Medical Reserve
Yeah,
Corps.
thank you.
Yeah, you're
Okay,
welcome.
thank you for bailing me out. And so as we get prepared to do things, and the same thing with you. I mean, what can people do to volunteer to make a difference? And what does that type of organization mean to responding to something?
Sure. So the Medical Reserve Corps is a tremendous force multiplier for us. To be able to tap, we do a lot of disaster mental health and disaster health services. So if we have to open up a large scale shelter after an event, folks have lost their medications. They need someone to talk to. So the Medical Reserve Corps is a valuable partner. But we need volunteers each and every day. We respond to home fires in Albany County, 3 or 4 times a week. So in the city of Albany, it's almost every other day we're responding to a home fire. When someone loses everything in their house due to a home fire, Red Cross volunteers are showing up and providing immediate assistance. So we need 90% of our workforce. So when you see the Red Cross, 90% of that workforce is volunteers.
Right.
And we're not coming from, somewhere out of state. They're folks in the community. So when you see a disaster in the community, those are your neighbors stepping up. And we need more neighbors stepping up as weather events become more severe.
So, and it's going to be a question thrown at the two of you, so to get into the medical corps, but I always get people like, well, how can I volunteer? I don't want to be on the front lines. I don't want to do this. And I go, well, it's like being a volunteer fireman. You got fire police that just go to intersections and they're flaggers. There's people that just go back to the firehouse and get coffee read them or help them clean up their equipment or help them with the admin side of the house. So what would you two say? And even with the medical corps, like that's the same thing. I think people think you got to be a doctor or you have to be in that field. So this is a loaded question for you two, and here's the opportunity to give a pitch to anyone listening to this to say, hey, here's how you can help out.
Yeah, I would say whenever you volunteer, there are many, many roles. So it's not just for doctors. It's not just for mental health professionals. We're certainly looking for those individuals to help, but those individuals need support. So anybody, retiree, somebody who's off for the summer, anybody who's willing to give their time, any neighbor who wants to step up and help another neighbor, there's plenty of jobs to be able to ask you to help with. So anything from just checking people in, greeting somebody at the door, those are all really critical people to any of those operations. And so anybody can really help. All you have to do is say yes.
Yeah, and I saw it like with the 9/11, we had massage therapists. They came in and when someone got a break for 15 minutes, just gave them, a quick shoulder rub or just people there talking to them just so they can just say, hey, we're here for you and just listening. So here you go.
Yeah, I have an animal visitation team. I have, volunteers that bring their pets that are trained to come to disasters and, help make the shelters a happier place. I have volunteers that work virtually that never go to a disaster operation, but they work at home and they can help us with just deploying our volunteers. I have folks that are really good in social media and they do our social media. Any skill that you have is transferable to a humanitarian organization that can serve, the community. So there's so many different ways to get involved, including I have one position where, all of the blood that we talked about, I have volunteer drivers in the capital region. I have 50 drivers that drive blood from the blood drives to the hospitals to the testing facility. And they're on the road every single day of the year. And also emergency. If there's an emergency at one of our area hospitals, volunteers will get up in the middle of the night and drive that blood product over to that patient in need. So those are all volunteers. So there's so many different ways you can get involved. You can go to redcross.org and just find an opportunity that works for you.
And our medical corps, which you were talking about, how's that help out with the American Red Cross? Why is it so important that the two organizations work together? And many organizations, obviously, if anyone's listening to this.
Yeah, well, it's really about the partnership. So, Kevin was saying the disaster relief, that's really important. But he was mentioning sometimes people need help with medications. Sometimes the situation is such a large scale that we just need to pull more of our volunteers. So it's really about the partnership. And, it's a partnership across the entire event. So we do a lot of focus in our emergency preparation to get out the messaging about those emergency preparedness kits. How do you make sure that you're ready ahead of time? And then when it's actually time for the response, that's where that partnership comes in and making sure that we have people who are there ready to help.
So Kevin put out for the American Red Cross. Where can they sign up to volunteer for you?
Yeah, you can go right to the health department website, albanycountyny.gov. Go to the health department's website, and there's a link right there to sign up. Again, anybody with clinical experience, physicians, medical assistants, pharmacists, nurses, but anybody who really just wants to come and help with some of those other things that we need help with, greeting at the door and things like that, all those things. Anybody who wants to help, we're absolutely happy to have you.
And it's so important because I know before, and being county executive for a while now, that we talked about volunteers because that was going down for a while. We're having a shortage of that, and it's harder nowadays than it was 40, 50 years ago because both people are working, or someone, or just if you're by yourself, you're working multiple jobs to get by, and they're like, I don't have time. But there's things they can do from their home, right? I would imagine there's things they can help out, calling people or getting information out there, or just if they're home and just pump out your information on their own personal Facebook or social media to help out. What would you say to all that? This is your opportunity, you two, right now on the spot. How you going to answer all these questions? And here's a pitch to everyone listening.
Just being a supporter, right? You made the point of just resharing the information. Only 3% of the eligible people are able to, who are able to give blood, actually do so. So even just being a supporter by resharing the information about local blood drives, about public health prevention messaging, just being an advocate and encouraging anybody who is eligible to go ahead and sign up. That's a great way to help, even from home.
Yeah, and for me, it's just get involved, get off the bench. Right, the community needs you and the Red Cross is just one organization. There's so many organizations, whether it's the food bank or a number of organizations. Communities thrive when they're connected and support one another. So we see the very best of communities when disasters happen because everyone comes together and helps one another. We need to have trained volunteers when disasters strike, though. We know we'll have folks to help hand out a bottle of water and help with logistics, but I do need trained volunteers that can kind of deploy those team members and know how to set up shelters. So we always need folks to be able to be part of that humanitarian network. So, the simple way is just become a Red Cross volunteer, become a blood donor, or make a financial contribution to support our mission. Those are 3 simple ways folks can get involved.
And, the best thing about being here in the capital of New York is that you get a lot of people from all over the country or downstate, and they come here. And you see on the 518, or you see these different sites where, hey, come hang out at this social. We're going to have a social thing at this certain bar and come meet people your own age. What a better way for these younger kids to get engaged because, A, you're going to go through training. B, you're going to meet people that have been in the community for years. You're going to develop friendships or networking. And to me, that would be a pitch for the younger people and the people that have retired. Like one of the most moving things with me through when we went through COVID 6 years ago was that the fact that all the doctors and nurses and medical professionals that just said, hey, I could sit home or I could help out. And they came out and, I was joking around with this one doctor who I knew for years, but he hasn't practiced and he was just helping out with the paperwork. He goes, I'm long doing vitals and that stuff. It was great. And I said, well, this is great to see you on this end. Now you know how your administrative staff felt. And he goes, yeah, I didn't like it. But it was just they want to give back, and they can. And for the younger kids to capture that audience to say, hey, you want to meet people, you want to network, and you don't want to do it at a bar or a social event, come to our organizations. You're going to meet people from the community, and you'll probably develop friendships that will last forever.
Yeah, volunteerism is a great way to build community. And so I have noticed that, I think younger people aren't quite always sure where are those places that I can build community. So I think you make a great point. Get involved, come to a blood drive, volunteer for a blood drive, be part of that disaster response team. You will make lifelong friendships. And what a great way to give back and find purpose.
I'm so happy you shared that story about the doctor because we have some volunteers who come to us with life experience or work experience and like, I want to do this here. And then I have some volunteers that come and say, I did that in my professional life. I want to do something completely different. I have one volunteer right now who is in Spokane, Washington, and she's working at the warehouse operating a forklift. It was she was a school teacher.
Right.
And now she came to us and she got trained to be able to work logistics and she's running a forklift and she's in a completely, happy place being able to do that work.
But that's the key, Kevin. She wanted to help.
Yeah,
right?
exactly.
And so it doesn't matter the skills. She said, hey, I'm willing to do something else. But it's really the desire to help. And I think that's the key.
Which I totally agree about, and I like that story because I honestly thought I was going to give the doctor a hard time. Boy, did he turn it on me. So I was like looking to get a little chuckle out of it, and I'm like, well, this backfired. But it is like people, certain people just, hey, I've been doing this for 40 years. I've watched people come out of the military, and they're like, I need to do something else. I don't even think. And I go, what do you mean? They go, I've been doing the same thing. I can close my eyes and I know what I need to do. I need to engage my brain differently, and especially as you get older, right? You want to challenge yourself. You want to just make sure you're keeping a skill set going. And you just said it. A teacher said, hey, I taught in a classroom. I could give all the lectures and I could do everything, but I want to do something I'm not used to doing. Come out of their comfort zone. I love it. I love that story. Here's your 2 final pitches. What would it be right now?
Become a Red Cross. Become a Red Crosser. There's such a simple way that you can support your community by being involved. You can donate blood. You can share. If you can't donate blood, tell your friends to donate blood because it's important. Become a volunteer. Take a CPR class. Become become certified in first aid. There's so many ways that you can be involved in our mission to strengthen community resilience, and I think just stepping up is important. So visit redcross.org.
Thank you, Kevin. Dr. Navarette?
Yeah, I would just say community participation. I think you said it right. Step up. There are so many ways to get involved with your community, and times are really challenging right now. The way we get through this is the community coming together and people stepping up and caring about our neighbors. And so I think there's so many different ways to do that. The Red Cross is a great partner organization for us. We certainly have our Medical Reserve Corps, and I think every day, just a neighbor helping neighbor, it's really the most important thing right now.
It is so important, and both organizations are a fabric of the community that do extraordinary stuff. And again, most people aren't paying attention, right, until something goes wrong. It's the same thing in government. Everyone's happy until something goes wrong, or you raise taxes, and then and they're like, what happened? Or unfortunately, when they're having a disaster, and they're like, well, where are these different organizations helping out? And sometimes it's like you want to do more, but you need the volunteers to do more.
That's right.
And again, even if you volunteer a half hour, an hour, whatever it may be, it makes a difference, and especially someone going through a tragedy. So I do want to thank both of you for everything you do to keep our residents healthy and safe. And thank you for everyone listening. And if you enjoyed today's episode, be sure to check out Albany County Direct on Spotify, Apple Podcasts, and YouTube Podcasts. And don't forget to subscribe so you never miss a new episode, and especially with this one. And we'll put a link for both of your bios in there so that people can click it on, make it easier for them. And, for the Monday morning quarterbacks out there, please tell us what we're doing wrong. And if you're so good at the keyboard hero stuff, you can help out these great organizations and get the word out there for us. So I would appreciate that too. So we'll see you next time on Albany County Direct.